you can see in this graph that even young women under the age of 30 have about a 35% chance of having an abnormal embryo, so meaning 1 out of 3 embryos, 1 out of 3 embryos would be chromosomally abnormal. This allows us to select a normal embryo for a single embryo transfer and still give a very high rate for a successful live birth. As women age, unfortunately, this ratio shifts. At 36, it's about 50-50, so 1 out of 2 embryos would be abnormal, and by the age 40, it's only 1 out of 3 would be found to be normal, and that ratio worsens as women age. As we are increasingly using genetic testing in IVF, we are discovering that there are some patients, a small select population, that despite the transfer of a chromosomally normal embryo, implantation will not be successful. Due to advances in endometrial research, there is a new test that is called Endometrial Receptivity Array testing that can give us information that will help improve the chances for an embryo to implant if it is chromosomally normal. This test involves a process where a woman undergoes stimulation of the uterus as if we were preparing to transfer an embryo. Rather than transferring the embryo, at the time that we would do the embryo transfer, we pass a little catheter and perform an endometrial biopsy. That tissue is sent for an analysis. They look at the expression of 236 genes and determine a specific pattern that says the endometrium is either receptive or pre-receptive or post-receptive. This can help us refine your treatment process, and when we actually prepare the uterus for embryo transfer, that we're transferring the embryo at the optimal time to give you the highest chance for a pregnancy and a live birth.